Take your medication. If you've just been to the doctor on Thursday for an infection and he gives you some antibiotic, if it's an antibiotic that you should not consume with alcohol and it has to take you for the next 7 days, which means that during the Christmas season you will have it, you're going to have to make a decision right now whether I should start it or whether I should wait after. Now, this is going to be based on you and know what is most important for you. So which is most beneficial, then you decide. But I would recommend that you go ahead and take your medication and get rid of that infection, because the infection could seem simple, but it could get worse after a few days. So treat yourself. You can always have another glass of wine. You can always ask them to leave a piece of ham or a piece of turkey, or leave that the cake, the wine, the alcohol cake, the wine cake. You can always have it afterwards, but it would be best to treat that condition right now, which is an acute condition. It's something that just came up. It's not something that you've been on. So you, however, will have to make that decision. But my advice to you is to take your medication, wait until after then.
Even with cake that has some wine that can affect your medication?
Oh, definitely. There's some prescription drugs. One in particular is an antifungal that is, most people might know, it's called Flagyl or metronidazole. You should absolutely stay away. Almost, I want to say, the scent of alcohol, because for the purpose that this drug stays as long as, maybe if the treatment course is for 7 days, I usually tell the patient, let 10 days pass before they consume any more alcohol, because the effect of this drug and the alcohol, which is another drug, is fatal.
Fatal?
Yes. So you want to stay.
Which means it's not true?
Yes. It can get to that point. So you want to stay away from it. There's some drugs, like I say, you can take a little bit of wine, not with it, but during the course, because it depends on the structure of the drug. It depends on the half-life of the drug, how long it stays in your system, and the season usually starts or has already started for a lot of people. So they're already consuming, but you're still taking your medication. That can still have a long effect, not a good effect on you.
We're talking tablets and spoonfuls. We'll be right back after the word from our sponsor.
Leana sorti Dr. Kote Hasbro di ma we number 1 mali pièce biology lete maman idi c'est eulogy idi number 2 pa mette mo sous ice mo hani of idi ma we di gati sortu ka pali no speak life man they mene ali da kote quick care pharmacy la you want to la see what this year yani ouvert après 72 hours of sleep, because everything about quick care pharmacy speaks of life plus nani bell clean spacious plans different list have your medicament pack or the air condition. Oh, see what is your oasis in a desert land. You just want to sit and relax and enjoy the health education corner about current health issues. Go to Quick Care Pharmacy and Halsbro, set up your blood pressure and sugar check one time and get your top up too, and I you put 20 on my cell phone. And of course, over the counter drugs and prescription drugs. Après and ID more individual à l'écoute Quick Care Pharmacy. Her outlook on life has changed. If you buy any buy medicine, may you pally buy. Actually make exercise to live on my tank and leave him away. Get up, lazy Harry. Harry him toujours à the elastic weapon last sir. The last shall be the first Harry. Move that body, Harry. Quick Care Pharmacy are over Monday, Wednesday, Friday from 9 to 6 and Tuesday, Thursdays and Saturdays from 9 to 4.
Okay, welcome back to Tablets and Spoonfuls on your radio, and we continue looking at the foods we eat, we consume during the Christmas season, and our medication. Gotta be careful, not because it's a season to be happy, to be merry, that you can consume any amount of food or alcohol and forget your medication. So we continue now, and
yes,
some other things you want to talk about.
Yeah, something we've spoken about before in previous programs, but I want to mention it here today as a reminder because it is critical, it is important. The medicine we know often comes with a warning saying to avoid alcohol. However, with the discussion with your pharmacist, you can know which ones that are more critical than others that you should absolutely refrain from alcohol. The warning is put on there simply because it is due to the pressure that the alcohol puts on the function of the liver, which can eventually damage your liver. And we want to look at alcohol, codeine, alcohol, paracetamol. So we want to look at cocodamol, paracetamol, aspirin, diclofenac. But I want to focus more so on the paracetamol that a lot of people during that season might say, I have a headache and I need to clear, but they're drinking. Taking a paracetamol right next, because I see it in the shops. I go to the shops, that sell the liquor, the paracetamol, the box is open, it's right next to the alcohol. I've seen in parties where the paracetamol is right next to the alcohol. If somebody have a paracetamol, they say have a headache, they say, oh, look at 2 paracetamol, man, take it. This is dangerous. So for the season, if you have a headache, try and go and
I'm with you too.
wait it out.
Yeah.
Go and try and wait it out. Some other way, drink water, hydrate yourself, but refrain from using paracetamol,
If you take in alcohol.
cocodamol, aspirins, diclofenac, naproxen, ibuprofen. Those can affect the stomach, but we're looking at what that can affect the liver, like almost instantaneously,
Paracetamol.
depending on the concentration. Because we know guys out there, when they drink alcohol, they drink alcohol. You understand?
Well, I often wonder how people can drink
And
all
they
that
still
alcohol.
sometimes drink the alcohol and they would take the paracetamol and water it down with alcohol. This is dangerous, my people. Do not do that. Do not encourage anybody to give you paracetamol because you have a headache, or you just cut your finger because you're trying to cut a piece of cake or a piece of ham, you know, that kind of thing. Or you just hit your waist against something and it's painful and you want to enjoy the rest of the night. But for you to do that, you must get a painkiller. Wait it out. Do not consume cocodamol and paracetamol with your alcohol. Your wine is the same thing. Your beers is the same thing.
Guinness.
Refrain. Guinness is the same thing. It also has a percentage of alcohol. Refrain from the use of paracetamol. You have the headache, you can continue consuming your alcohol, which I would not advise. However, do not take the alcohol and paracetamol. Or you have the other choice to not take the paracetamol and wait it out and stop the consumption of the alcohol. As you hear people wonder, why is it that he has a liver problem? He's not an alcoholic. Why is it she has a liver problem? She's not an alcoholic. But then it just happened that maybe once or twice she's consumed or he has consumed alcohol and used paracetamol consistently, even before the consumption of the alcohol, but taking a lot of paracetamol for simple pains. And the percentage, the levels of that drug within the system, because it's forcing the liver to metabolize that drug. So that can cause damage to your liver. Same thing when they do the energy drinks with the alcohol. You're affecting the central nervous system. You're speeding up the heart rate during the festive season. Know what you drink. Do not mix your drinks. That is another critical thing. Know what you're drinking. Know who's pouring what you're drinking. It can affect you mentally, physically, and particularly for the people who are out there, because we have quite a few persons out there who are hypertensive and diabetic. The alcohol will not only affect your blood pressure, it will cause an elevation in your sugar. So don't think because I'm hypertensive and not diabetic, it's not going to affect me. It can still increase the level of the sugar in my blood.
Because alcohol basically is sugar in the end.
It's going to metabolize to that and increase the amount of sugar. So just be responsible for this season. We just thought that taking this opportunity in this program right now to remind you how serious it is to not combine
Your medication and your alcohol.
And the foods, like we said, and the foods too. The
People
fatty foods, a
love
lot
it.
of ice cream, a lot of pork with fat,
Oh
and
my
chicken
goodness.
skin
you
and
can see
fried
the-
foods.
Oh, man. You can
All of
see
that
the grease
causes-
running down into their mustache.
All
down
of
their
that,
chin.
yes. All of these, they are culprits to acid reflux. People complain, why is it that every time I feel nauseous or I feel my stomach, and they're trying to figure out. But it is simply because, in a lot of cases, I'm not saying all the time, but in a lot of cases, the consumption of these fried foods that we have in such abundance, you understand?
And the fatty food.
And the fatty foods
And it's
and the
Christmas time, the
sweet,
pork and, and the
sweet,
beef.
sweet
Ah,
food. And
pigs and-
they mix the different forms of alcohol with different bush herbs. You don't know what you're mixing. It tastes good, yes, but what is it actually doing to me and the drugs, the medication that I'm on? So you have to decide what is most beneficial to you during the Christmas season. Is it being merry, drinking and
yeah.
fattening for a couple hours, and then afterwards, whatever will be? No, I think you should be more serious. For those of us who have families, we don't want to see them cry, you know? So listen to your parents. For the young people out there, listen to your parents. For some husbands, listen to your wives. For some wives, listen to your husbands, you know? And take your medication and forget about consuming lots of alcohol and food during the Christmas season.
Yes, lots of food. Like we said, you got a bag of bread nut guenpe. You pour bread nut into that bag. After a while, it gets filled. I mean, you can't pour more bread nut in the bag because it's filled.
Exactly.
Overflows.
It's
so
overflowing,
your
and then-
stomach is a bag.
Yes.
You can only take a certain amount.
Yes, so you might end up having to deal with either diarrhea, constipation, or even vomiting.
I mean, but the better belly
Boss
belly
than
wa-
good food
belly
waste.
boss than good food waste. Yeah,
Yeah, that's what we used to say a long time ago because we
we didn't
eat.
do better. We're ignorant.
Well, yes, that too, but I also think that we ate better. The foods were more, it was much healthier, prepared in a better fashion. Today you go and you say you go and buy a piece of fried chicken. And what is fried? It's just the skin. When you go down into the chicken, you realize it's not properly cooked. You understand? So I think,
Even blood.
yes, we need to take the word for the day is be responsible during the Christmas season where your drugs and your medication are concerned. Choose which is most important to you.
For those of you already planning to eat extra because it's Christmas, take note.
That's right. I hope nobody comes and tell me, boy, Maf, I heard what you said, but I could not help it. And right now,
You better help it.
I am in trouble. I will still help you, but I'm trying to tell you right now, it's a thin line between that. And we don't want to take chances.
Be wise.
Be wise.
Let wisdom be your sister.
That is right.
And understanding your kinswoman.
Amen to that.
Because you could surely end up at the casualty department.
Oh, yes, and we do
And
not want
on
to
the
put that.
water.
And this is a time when they're overworked at the hospital, the casualty centers. They're overworked. We do not want to unnecessarily overwork the nurses and the doctors during that season. So let us be responsible, be wise, like Felix say, and let's do what we're supposed to do.
Something else that can affect your medication is smoking, I understand.
Smoking certainly can affect some form of medication that you may be taking as well. It can also cause stress on the digestive system. And I mean, we do have people out there who smoke and they still complain of acid reflux and stomach upset. And it's a possibility, it could be the effect of the smoking. So we want to be aware of that too during the season. And during the season, people will smoke. Some people like to hold a cigar in their mouth. It's Christmas. I feel nice.
Vary.
Vary.
Or
You say.
vary.
Yes,
Because
it's just
other people smoke, they smoke.
yes. So if you know that you complain about heartburn, chest burn, stomach upset, that is an indication that it could be the smoking and the amount that you smoke at a given time. And you may want to increase that during the festive season, just like the alcohol. You want to think twice because you're going to spend some money after the season. So you have to decide, it's Christmas, the celebration of the alcohol and the food.
Like we said, that's not the reason for Christmas.
That's not the reason for Christmas, but however, that is the culture. That is how, people celebrate Christmas. But we want you to be responsible during the Christmas season. So remember, the word for today, the word for the Christmas season is be responsible where my drugs, my prescription drugs are concerned with all the goodies for the festive season.
And even, like we said, paracetamol, over-the-counter drugs
Yes,
too.
that is the most focal point actually, because people will complain about being tired, like
So
you
all you
feel-
need is some rest.
Yes, resting is
Instead of
also
taking
critical. That's
instead
right.
of paracetamol.
So let us not put that paracetamol next to the whiskey or to the, I don't want to call any rum in particular, but alcohol. Let us not put it next to each other because it is not the best and the smartest thing to do. Have a headache, choose to continue the headache and leave the paracetamol alone, or just go and wait it out and leave the alcohol alone.
We're talking tablets and spoonfuls on your radio, and we hope today you heard something that will help you, help your neighbor, help your cousin, help your friend, help your family. Maybe they will not hear this program, but you can tell them what you heard on tablets and spoonfuls. It may just be very, very critical to that person. So each one help one. It's the Christmas season, and so that's one way you can help somebody. Could be a precious gift of
That's
life.
right. That's right.
So I'm sure you'd like to wish all our listeners a Merry Christmas.
For sure. I want to wish everyone out there in the Dominican arena, I want to say Merry Christmas. And like I said earlier on, wishing you a prosperous and healthy new year in 2017, God willing. During this Christmas season, be responsible and do what you need to do until we talk to you again.
Yes, so have a healthy Christmas.